Those of you who don't know me, I'm Brett New. I'm very privileged to be the executive principal of this wonderful and unique establishment we call Dubton College. So a warm welcome to each and every one of you, individually, from your organisation or to your organisation, and collectively as a group of dedicated professionals whose working life and sometimes our personal life revolves around those very precious people, our young children. This is the second of 4 public forums that Dubton College are hosting over the course of the week. We're very lucky yesterday to have an overview of what's happening in one of the leading exponents of early childhood development, early childhood education from Canada, Professor Jane Bertram and Professor Carl Corter. 4 years ago, Dubton College was a concept and a few architectural drawings. And in that very short time, those of you in government would realise, to go from a concept and an architectural drawing to a vibrant community centre, providing family and children's services for the children of Dubton, it's quite remarkable. Governments normally don't move that quickly. So as we move into the 3rd year of our operation, it's incredibly timely for us, A, to celebrate what we've achieved in those 4 years. It's time for me to reflect and be incredibly daunted about what we still have to do. It's a time for us to reflect, and it's a time for us to also evaluate. Evaluation is front and centre of what the college is on about if we're going to have an impact on the children and family of Dubton. We need to be able to look at what we're doing, come to an understanding to make sure what we're doing is going to achieve the very high expectations we have about why we're here. Dubton College, in the first 2 years of planning, was greatly influenced by what was occurring in Canada, and particularly what was happening in Toronto, in Canada. Toronto First Duty. Many, excuse me, many of you here would be very, very familiar with that work. A program that's been operating in Toronto for over 12 years and now moving out into the other provinces of Canada. For this week at Dubton, we've been incredibly lucky to have 3 of the key people who have worked in both the development of Toronto First Duty and in the evaluation of it. And I talk of our friends of Dubton College, from the University of Toronto and from the Atkinson Centre, Jane Bertram, Carl Corter and Jeanette Pelletier. Why are we here? When we talk about Dubton College, we're here for the children. And very often, when we're putting programs in place, we're doing it for the children. And very often in programs like this, we as adults believe that we know what's best. I'm incredibly excited about the presentation this morning because it's going to give me the opportunity, and it's going to give you the opportunity, to hear Carl talk about how we evaluate programs for children in the best interest of children and what we hope to achieve with them. And that's going to be followed up by Jan. And I think Jan's perhaps turning some things on its head. We as adults, we as professionals, with the very best intentions, do what we believe is best for children. Jan's work is demonstrating to us that children, even very young ones, have voice, an important voice in the decision-making process and what informs the programs and the outcomes that we're going to aim for. Can you join me in welcoming both Carl and Jan to our forum this morning?
Everybody, is this working? Good. So let me say thank you for that introduction. It's wonderful to be here with all of you who are working on behalf of children. But I want to start out modestly by saying that I'm not an expert on program evaluation. I'm really a developmental psychologist, and I want to understand what supports children's development, what makes them tick, and part of that is understanding the family. A very important part is also understanding community influences and the programs that children participate beginning well before the universal school platform. So I've come into program evaluation in the latter part of my career, and it's been terrifically exciting in terms of my work on the Toronto First Duty project, which Brett mentioned. And I think that's been very exciting because it's the application of knowledge about how children develop to trying to improve the way programs are delivered, and that integration might be an improvement that makes for better quality environments, supports children's development in important ways, and supports the families around children. So I'll talk a little bit about Toronto First Duty and our experiences in evaluating that a little bit later, but I think some of you heard yesterday's fairly extensive report on Toronto First Duty. How many were here yesterday and heard that? So there'll be some repetition, certainly, but I'll try to make this much more general. Because I'm not an expert in this topic, and I'm not ordinarily giving presentations on it, putting together this talk reminded me of my early career when I was a young professor, and I was constantly called upon to give lectures every day on topics that I wasn't an expert on, and I'd be up late at night preparing those lectures. So last night was one of those deja vu experiences of what it was like to be someone who's called on to present a little bit outside of their zone of comfort. And a lot of these are new slides, and I'll have to read them along with you to see what I was thinking last night. So here we are. So evaluating programs for children, I'm sure many of you know a lot about this, and that's a really broad topic. And I just want to lay out a couple of my biases about the field before we move on to the formal outline of the talk. I think the reason we should be doing evaluation of programs and the programs themselves is to improve the lives of children and of their parents so that they can support the kids. I think that the best program evaluations hear from all of the stakeholders involved in the program, the parents, the professionals, and particularly the children. Jan will expand that in her talk. I think the best program evaluations include process, not just outcome. So process means we have the program, we measure outcomes typically, but how do those outcomes get achieved? If we don't understand the processes that may lead to the good outcomes we want, we can't necessarily sustain program effects and outcomes over time, and we certainly will have more difficulty scaling up those programs when they move into new contexts and we're not conscious of the processes that made the program work in its original context when it was first evaluated. My final point is that we're talking a lot about formal analysis, where a program is evaluated ideally by someone who's arm's distance from the program. But I think a very important kind of program evaluation is the kind that takes place every day when professionals implement and use programs and they think reflectively about how the program is working, how it could be improved in their context, and whether the processes that make the program work are unfolding as they should. So those are sort of my biases. The outline of the presentation, I'll first talk about, well, why do we evaluate? Because I think we have to go into evaluations with our aims clearly in mind, and for different evaluations, the purposes may differ. Secondly, of course, the question of, does the program work? Does it lead to the intended outcomes? And let me say that we have to be patient in many cases to find the answer to that. So in a project like our own Toronto First Duty, where we were attempting to rework a service system and integrate existing services, make or support people to work in new ways together, it took several years to get that off the ground. And my colleague who looks at education reform around the world and is an expert, has been here to Australia many times, Michael Fullen, says that to reform a school or a school system, it may be 5 years before you really see clear effects of those reform efforts, at least 3 years, because it's a complex enterprise when you're trying to change the way a school works. But imagine if you're talking about the kind of thing going on in Doveton, where it's not just the school that's changing, but it's the community services wrapped around the school, the way early learning hooks up with the rest of the education system. That's an even bigger organizational change. So the changes you're not going to see overnight. So does the program work? Can be answered more simply when you have a circumscribed package of, we'll run the kids through 12 weeks of this and then see if they're improving on that. That's a type of program evaluation. But the kind I'm talking about here are much broader, take more time to unfold. And the other point about does it work is that no single study should be relied on to make the decision about whether an approach is important. So we looked at integration of services, effects on kids in Toronto, but I wouldn't take that as the only picture of does it work. You can look to Sure Start research in the UK. You can look to other smaller scale studies around the globe and look for design principles that really do seem to work to make the lives of children and families better. So the fourth point, I'll talk about for whom does the program work. We have to be conscious that programs aren't a drug that work the same way for everybody that gets the dose. Different kids, different communities will require adjustment of the programming to make it suitable for them. And then I'll talk specifically about a couple of examples of program research. The large-scale study from the UK, the EPI study, the Toronto First Duty study. So that is where I'm going, or hope to go. It's coming back to me now, what happened last night at 1:30 a.m. when I was putting this together. So how do we know what works in children's programming? That seems to be something that people have asked more and more through the years, and everything now has to be evidence-based. Evidence-based practice, evidence-based programs. I think that's good that we're thinking about the evidence base and important questions. But why the hunger for evidence? Why evaluate? Well, there are many different reasons, and in one program evaluation, a number of these will generally come into play. First of all, there's the level of policy development and questions of adopting programs here, if they've been effective there. And I think that's more and more the way governments think about, let's sift through what's been done, look at the evidence, and try to make a decision about where we should put our dollars into policy development. There's also accountability for existing programs, reporting to funders, reporting to the agencies or ministries that support our programs, reporting to parents, and so on. So there's accountability, and that may be to different stakeholder groups. There's also, I think, more and more evaluation for what I'll call marketing. And I use that in a couple of different ways. I think sometimes my colleagues and I get cynical about the kind of marketing that is, I've developed a program and I've evaluated it, maybe with a randomized control trial, so there are no questions about its efficacy. And here it is, and I've copyrighted it, and it's now commercially available, and here's the evidence for you, and you should buy this program. And you know, there's nothing wrong with private enterprise and those things, but I think sometimes we have to be careful about getting carried away by the marketing that goes along with some of those efforts. You know, one example that you may be familiar with in terms of a really well-researched and well-marketed program is the Triple P program from here in Australia with Matt Sanders. Do you know that one? You know, it's really been marketed effectively around the globe and certainly in Canada as well. And it's done on the basis of, you know, a really wide range of research. And don't get me wrong, I think it is a good program. But, you know, I did read a paper recently in a health journal, a health evaluation journal, that was critical of the research backing Triple P because, you know, it didn't follow some of the health standards for what marketing should be of commercially driven products or drugs or whatever. And that is that the evidence shouldn't come from people who have developed the product and stand to benefit from people adopting it on the basis of the results of the evaluation. You have to declare your conflict of interest if you're both the program developer and someone who's marketing the program for profit. And I think, you know, we in the social sciences and education, early childhood, you know, we're not as sophisticated about some of the issues of marketing educational products as they are in health. So I think we have a bit to learn about program evaluation and the ethics of it. But there's another sense in which I think that marketing is really important to think about. And that is, even if you're not making a profit, maybe you're interested in seeing the good ideas you've discovered being used elsewhere and having other groups and organizations profit from what you've learned. So maybe you want to mobilize the knowledge from your program evaluation to help others in your state, in your region, in your country. So I think marketing and knowledge mobilization in a way that allows others to replicate or extend or adapt what you've done is really, really important to do for all of us, even if we're not into the business of making profit. So I think that kind of marketing, you really need effective program evaluation to do. And maybe some of your research design has to be intentional around, well, whom do we want to tell about this research? Are we going to tell the public and get them excited because we think it's good for kids and parents? Are we going to go to policymakers, professional groups? Who is the audience? The last two, I think, are my favorites in terms of why do it. One is we always have to think about program evaluation as a way of improving programs. We can't be satisfied with the status quo, even when they've been proven effective in a circumscribed study in one context. We have to think about, can we improve them as we implement them in our own context? Can we improve the program we have here at Doveton? Yes. Could we improve Toronto First Duty over the 10 years of study? Yes. That was a feature of that evaluation, that there was an aim for continuous improvement of the program as it developed and was implemented, because the developers weren't entirely certain of how this would look on the ground as the design principles were laid onto the 5 community sites that took on the Toronto First Duty model. The last thing that I think is really important, this is sort of the intellectual discovery, but it's also understanding how the world works. And I think you really get into understanding programs when you dig into the processes that really make them effective in a particular context and think about for whom are they working. And this kind of understanding is exciting, complex, and necessary, I think, to do good programming. Here's an example that I just pulled off the website of policy making and evaluation. So this is a decision guide for policymakers. It was put together by some leading evaluation groups in the field of early childhood in the U.S., but they say that their principles would really apply to evaluating for programs for children at any level. So one of the points is the evaluation design strong enough to produce trustworthy evidence. And I'll talk about different designs for producing evidence in just a second. What program services were actually received by participating children and families and by the comparison groups that you might want to use to see if there does appear to be an effect of the program. How much impact did the program have? And this one is a key one in the modern world. Do the program's benefits exceed its costs? The final thing is, well, think about the research evaluation you're reading and the context in which that study was done. Does it or would it appear to apply to your context, to your population, to the social ecologies of children in your community? So, I think this is a lot of the kind of thing you hear when we're talking about investing government dollars, what policies to adopt, and so on. I think one of the things that disturbs me about this is that it makes me think that policymakers are being encouraged to look at a single study, a single evaluation, and then say, well, should I adopt this program? And as a researcher, as a scientist, I say, we shouldn't do anything based on a single study. We ought to have converging evidence. So what's the pattern of evidence around the world, in Australia, in Canada, not going on the basis of, well, there was this randomized control trial in Australia or the US or Canada, let's do that. So I think converging evidence is really important. If you work with children and you assess children who are having difficulty, you know that you don't want to base any decision about a child based on a single assessment, right? You want converging evidence. Same thing with programs. Okay, does the program work compared to what? And, this is Research Design 101, which I taught, I think, in 1971 for the first time. But I couldn't find those notes when it was last night at 1:30. So there are different evaluation designs. I think that group who put together the Decision Maker's Guide would say, well, the strongest evidence, if you can get it, is from randomized control trial comparisons where children are randomly assigned to one program or no program or an alternative program or all three of those things. And then the comparison among those groups, because assignment is random, is only the programming effect, no other confounding variables. So that's great if you can get it. And maybe it works for circumscribed packages, but I don't think it can possibly work for something as complex as Doveton College's programming, Toronto First Duties programming. I mean, we did use comparisons, but imagining doing randomized control assignment, there are just so many difficulties in that. I could talk much more about this because I have discussed this with graduate seminar classes, but I'll spare you the belaboring, what I've thought about over a 45-year career with respect to research design, and just say that is sort of put up the top. But there's some issues with how it can be applied to some forms of programming. So an alternative is to compare the children in this program with the children in comparable community comparison groups, or maybe with norms across the state or regional government, if you can take into account the very important impact of demographics and economic levels and so on. Finally, there are also comparisons within a program group of children. How are the children improving within the program? How do cohorts of children within the communities which receive the program change over time? So those tell us something about program success and are important to do when it's difficult to do the other types of comparisons. Typically, these kinds of research designs about how well does a program work, does it work, are employing what we call quantitative measures, quantitative data that are gathered through ratings or testing or direct measurement that produce numbers that can be easily analyzed statistically. I think a very important question that we need to ask along with does the program work is how does the program work? What processes produce change, as I mentioned before? And typically the kinds of studies that are employed to get inside what's happening in a program are case studies where people employ qualitative methods, interviews, focus groups, other forms of narrative description, which really get inside the interactions that are so important to what's happening in programs. In addition to thinking about design and measurement, how are we going to lay out our comparisons? How are we going to measure what's happening in those programs or in the outcomes? I think the best program evaluations have a good conceptual framework. You know what you're looking for, and you know something about the pathways or processes along which change will be taking place. And some of these are in the form of logic models, some of these conceptual frameworks, what we call logic models, the logic of how the program works. Here's the program, here's the outcome. What's the logic of the activities, the inputs that lead to the things happening with families and kids that actually affect children's outcomes? I think a more nimble version of that is what we call theories of change, which is to develop some broader abstractions about what's happening and where a program can work to help children. So I think these tend to differ in complexity, with logic models being more detailed, and they're great for managing details and helping you think about how you develop and roll out the program. But I think when it comes to evidence-based storytelling, taking the evidence which these program evaluations produce and turning it into comprehensible ideas and reports, both for external audiences and stakeholders and for the people working in the program, I think you may need a more nimble theory that people can put in their head and operate on in the day-to-day. So here, for example, is a logic model from a neighboring city to Toronto by a group of people working there in early childhood who are very capable, and were working on a sort of integrated model that was then called Best Start. And you can't read anything on this logic model, but it's really saying, how do we get to the goal of having children being ready for school and ultimately having better development in terms of the programming elements that we're starting with in this integrated programming approach, the different pathways through the different kinds of programming. How do we get from those inputs and activities to things happening for parents and kids that lead to longer-term outcomes of kids doing better and doing better in life. So that's a complex version, great for managing a project, but not so much for getting people to have a coherent understanding. Here's a theory of change model from our own Toronto First Duty project. So we say, well, can integrated services in school hubs for young children really help in terms of outcomes for children's development and for their experiences? And we say, oh, well, when we look at our data, and as this program was being thought about, as it was being designed and implemented, we really think there are two pathways. They're the pathways of the programs that children experience and parents come into, because it's integrated programming for kids and parents, and what's happening with the family along with that. Is the family being supported in different ways that we'll get into as I come near the end? Are the parents supported for parenting, for their own needs to work and study? Is family life improved by having these integrated services? So the last question I think that we always need to ask about is, for whom does the program work and in what context? And I won't say much about this, except that I think it's a very, very important thing. We need to know about the children who participate in the programs, the ones in the program that are evaluated, as well as the ones that might be in new sites where the program is being adapted, and thinking about their demographics, and that can get very detailed. Like, maybe you say, well, this program looks like it would work for parents with both higher and lower education. That's good. Or maybe this program works better for parents with lower education, or vice versa. But then within parents at a particular educational strata in Toronto, it might be the case, and the Toronto District School Board has data on this, that families of different cultural backgrounds at the same educational level would have children who do differently in the school system because of family cultures and aspirations for education and so on. So this isn't simple raw statistical work. There's a lot of fine-tuning that needs to be thought about here. We also need to think about the ecologies, the communities surrounding children in programs, and how that's going to affect the implementation and development of programs. So one of the concrete examples of program evaluation I wanted to talk about is the EPI study in England, the UK, the effective provision of preschool and primary education. And this is a study that is magnificent, and I think we're all lucky to be able to hear Ted Melhuish on Monday, who will talk about this because he was one of the principal investigators. So why am I talking about it? Well, because as I told you before, I'm not really an expert on program evaluation, but it really is an important topic. So I learned by seeing what Ted and those people have done in the UK on these masterful studies coming out of this large-scale project, going on for more than a decade, started by looking at individual children in the preschool and has now followed them into the middle years of schooling. So here's a particular report from a couple of years ago from Kathy Silva, Ted Melhuish, and others in that project, saying, well, guess what, folks? It's not enough just to pack kids off to preschool or give them early childhood education. In most cases, if it's not high quality or good quality, you may be wasting your time and tax dollars. So, I think this is an interesting study and very relevant for policy makers around the world to think about. But again, let's not rely solely on this study, but let's look at it. So I learned by reading this. It's recommended reading. So in this particular study, they were looking at an evaluation of long-term outcomes of preschool program quality. And this was quality measured across different types of preschool programming. So it wasn't an evaluation of a particular type of preschool program. It was really quality across a variety of settings. Nursery schools, playgroups, and so on. So here is one example of the data that they found, and this will probably take a minute to come clear in my eyes, certainly, and maybe yours as well. But really the question they were looking at in this particular analysis is, does quality work differently for children from different home learning environment levels? So this cluster of bars on the left are children in what were called early years low learning environment. So these were homes that didn't have many books, that had fewer resources and less stimulation from adult to children. And these were measured directly by the EPI research team. These clusters of bars in the middle were medium home learning environment backgrounds. And these were the kids who came from the high learning home environment. Lots of resources. The different color bars are white, no preschool. Blue, pale blue is low quality, red, medium quality, black is high quality. So what you see if you think about the high quality centers and how they work for children from different backgrounds, you see that high quality works to reduce the gap from those kids who came from low home learning environment backgrounds and those from the highest. I mean, look at that. They're, neck and neck in terms of the evaluation of where they are. I believe these were math scores in level 6 education. So this is years after experiencing the early learning environment of home and school, and showing that both of those factors had an impact, and the programming worked differently, somewhat differently for high and low background kids. So I think that's really important, and there are many other findings from this series of studies that we could talk about. Findings for how quality affects self-regulation, not just academic learning at level 6 of the education system in England. So lots of important findings. But what I like about this article is not just the excitement of these massive statistical data sets that produce these stunning pictures of the complexity and what we have to think about in designing and delivering programs, but it's also the fact that Ted and his colleagues are not quantitative data fascists, if I may say it that way. They don't insist that the only good data are hard numbers and large-scale data. What they say is you have to take different perspectives on evaluating and understanding programs. So they say, and this is to take bullets from their discussion section, is the quantitative data are not enough. In these data, where there are lots of good quantitative measures, there are no deep explanations of the learning process. For example, they found that quality of the preschool environment had an effect, but they can't really describe from those numbers what quality meant in terms of what adults are doing with children that might have scaffolded or supported children's better cognitive development. They can't explain local circumstances of an individual preschool center, neighborhoods, cultural traditions of families. It does not measure the whole child and explain the developmental trajectory of individual children. And it doesn't capture the voices of thousands of children, families, and practitioners. So what they say is the EPI study is actually a mixed method study. They don't just have those quantitative data. They also do case study analysis, interviews that does get them inside the processes that help to understand what's happening when high quality programs are working to support children's long-term development. So I think, again, one of my biases I didn't put on the first slide is that the best program evaluations are mixed methods, not just big numbers to test inputs and outputs and program and outcome, but really get us inside the process through qualitative analysis. So the other project to talk about, and maybe do that briefly. How much time do I have? Oh, okay, well maybe I have time to talk about Toronto First Duty, which I've talked about so many times yesterday. This is more familiar turf. So, Toronto First Duty, okay, here we go, was a demonstration project. So it was an evaluation of a program that integrated services for children on an universal platform, starting early in life up to 6 years of age, and based in schools. So these were integrated services based in school hubs. And the aim of this program evaluation wasn't just to say, does this program work for local audiences? It was really done in order to change and improve public policy based on the findings from this study. And therefore, research and evidence-based storytelling evaluation was built into it from the outset. And the research and evaluation component was really richly resourced by foundations who were part of the team that put this project together, along with other supports that came from the City of Toronto, which was a partner who deliver many services for children and young children, and the Toronto District School Board, who were fully behind this idea of testing out this model in 5 school hubs, integrating services. So this was really the aims of the project as it set out in just after the millennium change. And this research and evaluation took what I would call is a design research approach. And design research is a term that's sometimes used in education to say that maybe, you know, as an alternative to testing fully formed packages to see whether they work and fail, and then saying we'll choose this one, and then going off and having problems with implementation because we don't really fully understand the workings of the program. Maybe design research is a better approach. And in this approach, you develop a theory of change about how your initial program design might improve things, but then as you roll it out, you test how it's working, not just in terms of outcomes, but in terms of immediate processes that might be triggered by the program that you think would then support better child development. So really, you implement the program, look at the processes that are unfolding, measure outcomes as soon as you can, and what you do in the design research approach is to feed back those findings into the sites that are implementing the program for continuous improvement. So design research is a cycle, an iterative cycle of findings about process and outcomes that are fed back to the delivery team, to the sites, who then try to improve on that basis. And I think this is really a powerful model of program evaluation that doesn't get talked about often enough. So when we talk about the design of the evaluation of Toronto First Duty, we say, well, it was a design research approach, but we can describe it along other dimensions. It was mixed methods, quantitative, qualitative, many of those differing types of measurements. There were 5 case studies at community sites. We followed the implementation process over time. And we did do some community comparisons with control sites that were similar in demographics to those in the Toronto First Duty sites, to look for how this might be affecting children and how it might be affecting parents. So we did some of those community comparisons. But another thing we also did was to look within the cohort of children who were going through Toronto First Duty. And because the programming provided a menu of different kinds of services, and because parents had different interests in accessing those services, children differed in the number of hours that they experienced in integrated programming in Toronto First Duty. So we did what was called a dose response analysis, in which we looked at children's outcomes based on how many hours they had participated in Toronto First Duty programs. And I believe, this is across hundreds and hundreds of children for whom we had data on in terms of the participation in the program and in terms of their outcomes. And for those hundreds of children, the range of hours was like from 5 to 2,000 in terms of hours, with the mean being somewhere in the middle of that. In terms of what we were measuring, we designed some of the measures ourselves, and then we adopted some measures from the existing evaluation literature. So in terms of looking at process, we developed a measurement that I talked about at length yesterday called the indicators of change, which was designed to assess how was change being managed in terms of different services coming together at the sites with a number of different dimensions: the team delivering the program, the governance, the access, the programming, and the integration with the parents. We also had an intake and tracking system which interviewed parents as they came into the program, got background information on experiences, and then tracked children's participation throughout their time in Toronto First Duty. From the outside world, we used the ECHRS, a standard rating of early childhood environment rating quality, widely used. We also looked inside the programming later in the implementation of Toronto First Duty to look at the experiences of children with an observation framework that Jan may talk about. We gave parents surveys, interviews, and one around their daily hassles to survey, what their lives were like in terms of managing connections between childcare, education, getting kids to school or care, connecting with professionals, and so on. And those all were things that we might call process variables. We also had a variety of other focus groups, interviews, document analyses, and field notes that went into this. So it's a huge data mine. In terms of outcomes, we have the early, is it the Early Development Instrument? EDI? Okay. It's just the lack of sleep. That doesn't look right. But it's the EDI, similar to your AEDI, if you know that, a teacher rating of how children are doing in 5 developmental domains. And then we had a variety of assessments of children's experiences and voices. Jan will talk about that. Back to our theory of change, we arrayed our data around this, like what is the program, what's happening with the staff and the programming at the site levels, what's happening with parents, and then are children doing better, trying to pull that together in a comprehensible storyline. And I really don't have time to go into the data in any depth, but each of these areas of the theory of change can be unpacked with multiple sources of data, analyses, and maybe I'll just try to show you a couple. I'm not going to talk about the staff teamwork because I talked about that yesterday, but I'll only say that through the course of integration, the quality of programming improved, and the integration of how the team worked together and the programming itself was more seamless as time went by. And we think that contributed to the good results for kids. In terms of the parenting, we believe from both the qualitative and quantitative analyses that this program worked partly because of the outreach efforts, partly because previously underserved families were being brought in to programming that they wouldn't have otherwise succeeded. We think it also succeeded to do that and other things because there was a menu of choices in the integrated array of services that gave parents choice. So they weren't offered a one-size-fits-all model of what kind of service they or their child should be in. The quality child care was a very important piece of this success story, we believe. Quality improved. Parenting programs were, of course, there to directly support parents. But I think indirectly, the supports for the kids also assisted the parents. So we found, in fact, for example, that there was a reduction in family hassles. So parents in the integrated site said, it's easy for me to find out about how my child is doing at school or care. In comparison sites, without the integration, cares here, schools there, they had more difficulty finding out about how their kid is doing. Just one example of how parents and families' lives may be improved by this kind of approach. So just to show you some quantitative data, at the point of intake, we asked families about their previous experience with services before they came into Toronto First Duty. And they could come in at any age following birth, but they tended to come in mainly around 3 years of age, sometimes 2, sometimes 4. So they would have had a background of experiences in other services before they came in for the most part. In this graph, we're looking at the comparison between English as an additional language families and English-speaking families in terms of service access. And the blue bars are the English-speaking families. The purple bars or red bars, the EAL families. For every type of service, except for one, the English-speaking families are using services at a greater percentage than the immigrant EAL families. So there's a service gap there that we really worry about when we're talking about equity and helping all children succeed. From our own study, when we looked at what happened after they came into Toronto First Duty, when we looked at participation rates, enrollment, hours logged, we found no effect of any demographic variable except for one, and that is that maternal education was related to program participation. But in fact, mothers with lower educational levels used the program somewhat more than mothers from higher educational levels. But because, that's good in terms of recovering from that gap that we saw earlier. But we want all parents to use these universal services and maybe those who need to use them more to do that in order to achieve their aims. There were other impacts on parental involvement. In the Toronto First Duty sites, parents felt more empowered to speak to the teacher, to feel successful in helping their child learn. But to get back to that point of not everything works the same way for every family, when you look across these different data sources and then look graphically at some of our results on parents feeling supported and engaged, you can see that things like immigration status might interact with whether or not we're finding success in these integrated sites. And for this particular question, does this program help parents understand that it's their responsibility to speak to the teacher regularly? And this was assessed at the point where children had entered the school system in what we call kindergarten, which is equivalent to your prep level. And we broke down the responses by immigrant families, the lighter bars, and by non-immigrant families. And what we saw was that in the Toronto First Duty sites, the program worked to increase empowerment. I feel that it's my role to talk to teachers, as compared with two types of comparison sites. Those with a single preschool service, not integrated services, and those sites where the schools had no preschool services at the school site. So here we see integration working for both immigrant families and non-immigrant families pretty equally well. But in the following slide, we see it working for both types of families, but the immigrant families still are below the non-immigrant families in feeling that they are invited to the school. So even though the schools do better in terms of connecting to the parents in the integrated sites here and here, you can see that the Toronto First Duty program didn't close the gap in terms of difference between non-immigrant families and immigrant families in feeling that the school welcomes them. So, this shows that there's still room for improvement in Toronto First Duty and its approach. And I think, what's happening here at Doveton College in terms of parent community engagement is something that we're going to learn from in Canada on that dimension of integration. So we also looked at children's development. I described that earlier in terms of looking at dose and showing that affected children's outcomes. Kids with higher dose did better on 3 scales of the EDI. We also did community comparisons, kids in TFD communities versus matched communities, showing that the EDI was better in the integrated sites. So I think that's enough. What about the children? Jan will talk more about their experiences. And I can just say that the general lessons from our evaluations: give policymakers stories of the process and hard evidence. We did that. And for those of you who weren't here yesterday, the stories from this project helped influence provincial policy in Ontario, so that now that's being scaled up into what we call full-day early learning kindergarten, where care and education are blended together for a full day at school sites for all children aged 4 and 5. So that's a first step towards wide-scale implementation of the Toronto First Duty model. And I think the stories, the evidence from this project contributed to that. Back to my point, it's not enough to get us started along a path of particular programming or adopting a program. We have to think about continuous improvement. We need to recognize the importance that what we do in schools interacts with children's health and other dimensions of development. We need to remember that context will modify program design and success. We can't take cookie cutter approaches to programming for children. So that's it. Thank you.
Thank you so much, Carl, for that rich content and so much for us to think about. As I said in the introduction, at Doveton College, we're into our 3rd year of operation. But right from the beginning, 4 years ago, building into what we're doing here at the college was some really serious thinking about evaluation and process and programs and outcomes. And I think one of the things that we've learnt with the very short time that we've had with Jane, with Carl, and with Jan this week is we haven't been looking enough at the process. We've got our programs in place. We have a very detailed set of outcome and measurement tools that we're working on, but Carl and Jan and Jane in particular, with the indicators of change from the Toronto First Duty, has really opened up our eyes to what needs to be done in the context that we're working in. Before morning tea, we'll have some questions if you've got them. There will be an opportunity at the end of Jan's session for questions, but while it's all front and centre, has anyone got anything they'd like Carl to pursue at the moment. It's an opportunity, it's not an obligation. Okay, we'll save them till later. Can you join me in thanking Professor Carl Corter again?
Thank you.
Some